Go. He's a good guy. I like Brandon. Good morning, everyone. Thanks for joining us on MorningLine. Nick Beres here with you on a Thursday. We have a good show on tap for you. It's this time of year where all of a sudden, we're approaching, I guess, springing forward. We're going to be adapting to the different weather, which to me, I'm more of a summer warm guy, but the big thing is the sunshine, and the light that we're going to have and what we've had over the last couple of days. But, there are folks with issues with seasonal affective disorder. I don't know if I'm pronouncing that right, but, depending on the seasons, it can affect your mood. It can bring depression on. There are things you can do to treat it. You probably have realized that. I was just thinking about how a few weeks ago we had several days of gray weather, just no sunshine. And I wasn't thinking about it, but I was feeling a little just not as much energy, a little down. I'm like, well, why? Nothing's really going on in my life. The job's fine. At home, we're okay. And I'm like, I haven't seen the sun in a week and a half. And it affected me. So we thought we'd talk a little bit about that today and dealing with that kind of depression or anxiety or whatever may come with that this time of year. Or, by the way, it doesn't just happen in the winter. It can happen in the summer, whenever there are changes in time and access to light and what your lifestyle's like. So who better to talk about that with than perhaps a psychiatrist that deals with it? A psychiatrist from a local university right here, Meharry. Dr. James McKenzie, good morning.
Good morning, Nick.
Thanks for coming in. How are you feeling this morning?
Feeling well. The weather's perked up a little bit for us.
That's key, isn't it? Well, listen, it's really good to have you on. I can't remember, we've had plenty of psychologists on this program, but I think over the years we've only had a handful of psychiatrists for whatever reason, but you're a psychiatrist. Most people may know that as a psychiatrist, he can, prescribe medicines. He is a doctor. But what are the differences? How would you highlight it if someone said, what's the difference between you and a psychologist?
Sure. Yeah, common question. There's lots of doctors who don't always keep it straight. Sure. Both of us work with mental health.
Okay.
We work together a lot, psychologists and psychiatrists. The big difference is our schooling and our training. And so psychiatrists went to medical school, went to a residency training program after medical school before we're practicing, and you would see us in the clinic. A psychologist goes to graduate school, earns a PhD, writes a thesis, contributes to the field of study there. And so they can be clinical psychologists also, see folks for talk therapy. There are actually a couple of states in the U.S. where psychologists can prescribe, but it's pretty rare.
Oh, okay.
But in general, if you've got a mental health provider who's also prescribing medications, it would either be a psychiatrist as a doctor or a psychiatric nurse sometimes we see.
So how does someone decide if they're dealing with some kind of mental issue, depression, whatever it may be, whether or not they should go to a psychologist or a psychiatrist? Now, for instance, a lot of people may go to a counselor or a psychologist. I don't know, that can blur over for marriage counseling or maybe just going to talk to someone about anxiety and how they deal with stress of the workplace. And we have a service here at Channel 5 where we can go to someone and talk to about things like that. After school shootings, when we cover things and we're shell-shocked from having to cover such a horrible story, someone to talk to. But that's not medicines involved. How do I decide if I need to go to a psychiatrist or a psychologist?
Well, sometimes the first step can just be reaching out and talking to your primary care doc is step one.
Oh, okay.
Or checking in. And so there are some mental health disorders that we see better results from talk therapy, and some things that we see better results from medications. But sometimes just saying, hey, something's off, I think I could use some help, talking to a doctor can help you figure out, is this the type of issue that I should go talk to a prescribing doctor, psychiatrist, or would this be something for a psychologist, a social worker, something who could maybe be quicker to get into sometimes, but would be perfectly suited for the problems I'm dealing with. So I would say, even even with your primary care doc, a pediatrician.
There, talk about it, and the decision may be, and psychiatrists can do some talk therapy as well.
Correct.
but oftentimes, depending on the condition, medicines can be prescribed, antidepressants, things like this, and that's something you can typically do that a psychologist, except in a handful of states, cannot do.
Correct.
All right. Well, we don't want to spend too much time on that, but that's good to know. And so let's just talk about this right now. I mean, you're coming on at this time. We're in the spring where we all should be feeling up a bit, but talk about exactly what is seasonal affective disorder. I tried to kind of cover that when we started.
Mm-hmm. That's perfect. Yeah, so that's the common term, seasonal affective disorder, seasonal depression people talk about. The clinical official doctor term is major depressive disorder with seasonal patterns.
Okay.
And so that is one way to let us know that this is something we're talking about that can be really severe, same as clinical depression, but the only difference really being that seasonal affective disorder has this consistent seasonal pattern. It always happens for you the same time of year.
So you can kind of know it's coming.
Yeah, usually folks they're like, oh, this always happens to me. You start to notice a pattern.
My mother dealt with mental health issues all her life. She's now deceased, but we lived in Oregon, where if you have an issue with cloudy gray days, that's not the place you want to live, because it pretty much rains there 9 months out of the year, which is a wonderful, beautiful place, especially in the summer. Everything's green. But she was to the point, and she went to psychiatrists all her life for treatments, and they helped her significantly. But she ended up with a light board. At one point, finally, out of the blue, and this was years ago, maybe when it was more new line of thinking, I forget what, I came home one day and there was this board someone had made for her with like 8 long, were they ultraviolet? I don't know what span light it was. And she's sitting in her art room doing art with this bright light blasting her. Meanwhile, it's gray and rainy outside. What's that about?
Yeah, so phototherapy is one word for it. Light box therapy, we call it. It's effective, and it's a way that you can kind of supplement those times a year where there's less light, or really for folks who are kind of northern parts of the world, just the way the world sits, you get less light. And so there are, I haven't seen this, but I've heard the Scandinavian countries that have light rooms. That because it's something that affects everybody in those parts of the world, that you're like, everybody's going to need it. We make a whole room of that.
It's great. Well, and I mentioned it because she kind of knew, especially coming into the winter months out of the summer, it's coming, get the light board out. She knew every year it was going to hit.
That sounds exactly like it. You know,
seemed to help. It seemed to help some, but I guess she clearly had something that was she needed to go to a psychiatrist for. But I wonder how many people are walking around out there that haven't made the connection, but for some reason in the winter they're just feeling less energy and but they haven't made the connections because they're not getting the light they need. You know, and maybe the effects are not as great to really start, you know, impacting their lifestyle, but they just feel lousy.
Yeah, sometimes we talk about winter blues as kind of like a step down from seasonal depression.
Okay.
So you've got some of the aspects of it. You've got, you know, your energy levels off, your sleep's off, your mood's off, you don't feel like yourself, but it doesn't check all the boxes for clinical depression. So winter blues, I think, is more common than we might realize. Estimates I've seen for Tennessee for seasonal affective disorder, around 5%.
Okay, 5% of the population has that level of sad. I say sad because that's classic. Did they come up with seasonal affective disorder because it spells sad?
Right, I think
it's perfect.
It kind of worked out.
Okay, it worked out nice. But so about 5% maybe have this where it's like, it's significant enough. I guess we should say then, I mean, we talked about the boxes to check. What are the boxes to check to determine if you actually have this, I guess the symptoms? We talked about depression, but what are they? Are there other specific ones?
Well, yeah, it's all the same symptoms as major depressive disorder or clinical depression, and so that's changes in sleep, changes in your appetite, changes in your mood, your energy level, your motivation. It can be feelings of guilt, just kind of vague feelings like you've done something
for no reason,
wrong.
out of the blue.
Yeah, just no reason, but you're just kind of feeling bad like you've done people wrong. And in severe cases, thoughts of suicide, thoughts of harming yourself. And so that's where we get worried and want to help folks out who are noticing this pattern.
Okay, and again, it can be various seasons, not just winter. I guess I was seeing winter, like for instance, some of the sad symptoms can include oversleeping, overeating, social withdrawal. Summer, trouble sleeping, poor appetite. It's like the opposite. Okay, restlessness and agitation, anxiety, maybe some violent behavior.
So one part of it is really the sunlight is important, but something we don't always think about is darkness while you're sleeping is crucial for us getting good restful sleep.
Really?
And so that's the other side of our circadian rhythm, which is our daily 24-hour sleep cycle. In seasonal affective disorder, kind of the root at it is changes in light, changes in our sleep cycle, our body not really adjusting. And so that's why in summertime, there can be longer days, depending on where you are. It can interfere with sleep. Same problems, it kind of messes up our hormone system and how we're feeling.
Now, can't some people, okay, so darkness, for some people, I had a friend who just needs to have his room like a cave. And so he literally put aluminum foil over his windows in his bedroom, which he didn't spend much time in except to sleep. But and you'd walk in there, close the door, and
Black.
it was ink black, okay? But, you know, heck, at our house, I mean, in the summertime, you know, I have to go to bed kind of early sometimes, but if I'm tired, and it's still kind of sunny out, but the sun's going down, I can fall asleep like that, right? I mean, but you really need it dark? I mean, or does it matter if you can fall asleep?
The darker the better. And, you know, if we could be a fly on the wall or genie, I would say probably if you had blackout curtains or you'd put foil on your windows and had really darkness while you were trying to sleep, it probably would have been a certain amount more restful, deeper sleep than you had gotten when light's creeping through the windows and it's still a little...
Interesting.
Yeah.
Okay, because with our room we have big windows and you know the light will come in the morning when it's dawn. The bigger thing for me is I had sleep apnea for a while. It's not real severe, but I got a CPAP machine and man, I finally adapted to keeping it on my head, which they're really good now. They're small little things. That has been better sleep for me than anything.
That's
I'm out.
Yes,
you can always look and
yes.
see, wow, I slept 8 hours last night. You've got to be kidding me without waking up. But anyway, that's interesting. I didn't know about darkness. Look, we'll take a break. We'll come back. There's a lot more to cover on this, on how you can deal with it. And the important thing is that if you're dealing with this, yeah, you can't change the seasons, but you can change the way you handle your own circumstances. So we'll be back, and we can take a few phone calls if you want to join. You've seen the number on the screen. Back with a good doctor right after this. Here we go. We'll talk about it. That's interesting. We are back on MorningLine. Thanks for joining us. Dr. James McKenzie's with us. He's from the Meharry Medical Group. He is a psychiatrist. And we're talking about seasonal affective disorder, you know, which is not just in the wintertime, which we're coming out of and we're going to have more sunshine. But yeah, you know, we discussed how light and sleep can play a real factor in dealing with it. What other factors then? First of all, I mean, are there certain groups of people in the population that are more susceptible to it, either age or gender, something like that?
So going back to last time talking about the real core thing is hormonal disruptions.
Okay.
So the folks among us who tend to have higher hormonal levels are going to be young people 18 to 30 range. So we see highest rates among 18 to 30.
Okay.
We also see about 4 times higher rates among women than men.
Of feeling some of these symptoms. But I mean, you're talking like 18, 19, 20-year-olds getting depressed or having some of these other symptoms we talked about, feelings of hopelessness and, you know, feelings of guilt, all that, at that young age, that hit.
Yep.
What percentage of the population of young people maybe deal with this?
Well, you know, so again, those kind of statistics, so
It's crazy.
it goes, for seasonal affective disorder, it's kind of interesting. It's unlike some of the other mental health issues where geography plays a big part. So Florida, the estimate is around 1%. Alaska, 9%. So you get kind of a gradient across the country.
Oregon was probably higher because it's so
Exactly.
gray. California, Southern Cal, not as much.
That was higher risk just living in Oregon, just being that higher latitude right there.
I wonder, this I would have suggested to my mother. If people who really have a serious problem with it, it's almost worth moving if you live in a place like Alaska. I'm just like, you know what? I love Alaska, but I can't live here with it being dark as often as it is. I got to get out of here.
If this was your life, if you were really dealing with that, I mean, if that was a thing that was possible to consider, I could move, if you got family in a different place somewhere else, I mean, that would make a serious difference. And so, again, we kind of see that different rate just by geography, but the idea is still that applies, that 5% about for Tennessee. More of those would be younger folks, those older teenagers, 20.
But not
30
seniors.
years.
So what about like when you're hitting 60s and 70s?
So it still can be. Nobody's,
I would
any
think by
adult age.
then maybe, if you had a clue, you've kind of learned to deal with it one way or the other, if you've had it.
Probably. Right. If you're getting into your later years and this has been a long-term thing, you've probably been dealing with this and figuring out ways around it for a long time.
Yeah.
But just our senior population, they don't have as big hormonal changes. And so luckily it doesn't, those time changes and the seasonal changes don't tend to affect them as much as it can younger folks.
That makes sense. And with women, I guess, right when you're going through menopause, is that a time when it can hit women?
It might, I think that's a good point.
I was wondering about hormonal changes that happen there.
I haven't seen that, but there are mental health issues that we see separately for men and women related to menopause, and that for older life men we don't see increases, but that is a significant change. So I think that's a good point. I didn't see that popping up, but I think that definitely could be true.
Well, you've been doing this, and again, you say you've got students that you work with, but you'll see patients. I mean, can you describe some of or if you can think of one, a severe case of it that sought help with you guys, and of course don't name names, but talk about how you went about treating someone when it was serious enough that they sought your type of help, and how it played out. You got an example, just a real-time example?
Yeah. So I think I could think of a couple of folks. I can think of a pair who are great supports to each other, but they're both dealing with some of this themselves.
They know each other?
Yeah. Yeah.
And like spouses or partners?
Partners, yeah.
Oh, okay.
And so they come to our clinic separately, and so they both have dealt with some seasonal patterns that aren't exactly the same. One of them seems to be more just related to the calendar. One of them, it's more related to anniversaries. And so that's something we can see too.
What do you mean, anniversaries?
So maybe sad anniversaries. We've lost somebody important to us.
Okay.
And that time of year comes around, we have a pattern of some depressive symptoms around that. So it's more related to our life experiences. But the two of them, they're partners because they know each winter they both have these similar experiences.
So, okay, and real quick, so that's real interesting, by the way, then. So you can have one which is seasonal weather related, but you can have another one that's seasonal event related. Maybe, something horrible happened, or at Christmas it's depressing because your family members have passed away. So either one of those can qualify because it's coming during a time of a year. It's that season, but that's something that triggers it. It may not necessarily just be weather related.
Right, that's when we're diagnosing this. That's the requirement, is that it only happens during that same season. It has this typical annual pattern. But that could be a case where somebody is related to things that have happened in my life, and that's what comes up, but it only happens this time of year. Every year, that would still be the same, meeting that. So this couple, we see that. They've come in, and we've been working with them for some time, and it's step by step.
Was it bad enough that, it was really affecting their day-to-day lifestyle when these moments hit? They were not able to function?
Yeah. So, it got to the point where it wasn't possible for either of them to consistently make it to work during the winter.
Okay, that's where it really hits you, is that it's affecting your ability to just get out and about and do what you need to do.
Yeah.
Okay.
And I think that's the point where their doctors, they had a therapist, a social worker who said, I think you guys need higher level of care. You need somebody who's a little more expert to talk about this, and that's when they were able to come in and see us. And so it's been a mix of medication for them and lifestyle changes that we've been talking about.
So that's where it comes into play. That's great. And as you said, sometimes you'll work with these counselors or psychologists, and they'll recognize, look, I can the talk here, but you need more specialized care, perhaps, and the medicines. So let's discuss that, the integration of medicines. And there's a lot of people, I have friends who have these issues, and they go, well, I just don't want to get a pill and be like some kind of zombie. And I'm like, because I've seen the experience with my mother, it's not like that. The pill is not changing who you are. What it's going to do is make you normal again, if it can. Make you back to the way you were. It's not drugging you. Right. But there's for a lot of folks, intelligent folks I know, there's a stigma attached where they think, oh, I don't want to go to a psychiatrist and get some medicine because I'm just going to be a drug zombie. I may not feel anything, but I don't want that. That's not what we're talking about here.
Right. I hear that all the time.
Yep.
Every week.
Yeah. And I have good friends I've encouraged. Go. It's going to help you. Right? And
it should. That's the goal. We can't guarantee the thing I give you first time, and that's the tough part. And so people do have real experiences of a doctor gave me a medicine, I felt worse, or I didn't feel better.
Doesn't it take a while for some of these medicines to build up in your system, so it takes effects anyway, which you tell them, I'm sure.
Right, and so we have some difference, but medicines that we think about for seasonal affective disorder are the antidepressants. Mm-hmm. And so those are medicines that take 1 month to 2 months of taking it consistently before it's working at full strength at that dose. So that's a downside. That's a delay. Mm-hmm. And so I know that's for a lot of folks can be tough. Because if you're suffering now, to tell me you got to wait 2 months and maybe you'll feel better.
That's hard.
Is not.
Everyone wants a pill now, right?
Yeah, that'd be the ideal. But what we do to help with that is talk about some lifestyle things, some other things that are not medicines that you could do today that could be helpful while we're waiting to see if that medicine is going to be the trick for you.
Can you, if you don't mind, can you name a few of the more used medications right now for these treatments? Just I want the names, and some of them, I'll see if I recognize some of them, because my mom used several. What are the ones out there now? And there may be a whole new breed of new ones out there compared to the ones she was on years ago.
There's a few. I mean, a lot of these have been here for a couple decades. So
what do we got?
The oldest one is Prozac.
Yeah.
Fluoxetine is the other name for that. They've all got
We've all heard Prozac.
Brand name generic.
Yeah.
Zoloft
Yep.
is a common one. Lexapro.
Mm-hmm. What's Seroquel?
Seroquel is an antipsychotic medication.
Yeah, I have a friend who takes that. I think they take it only in crisis moments, it seems like, when they were having panic disorder. Mm-hmm. Does that make sense?
Yeah, so we sometimes do something in psychiatry called off-label prescribing.
Yeah.
And so the FDA approves stuff for certain things, but they don't test every drug for everything, right? Mm-hmm. Companies have to apply for that. So what we know as doctors, there's some medicines that maybe it's not approved for this thing, but it's a cousin to this medicine that is. And so I might know that this medicine is a reasonable thing to help with this issue, even though it's not FDA approved. And there are times where we can safely do that if we've, checked all our boxes. So Seroquel, even though it's for maybe schizophrenia, psychosis, it is a medicine that is kind of sedating, makes people sleepy. It can be calming, and it's a type of medicine, unlike Prozac, that you'll feel it with one dose. So that's why you can take it just when you need it. There are side effects and downsides to it, but for some folks that could be really helpful.
And the Prozac, Zoloft, Lexapro, are they anti-anxiety, or are there other anxiety medicines? If someone is feeling, for instance, if someone's loved one just passed away, very real reason why they're feeling lousy. Now, my mom has a manic depressive, would just be crying, and I'd say, "What's wrong, Mom?" And no reason, she just feels crappy, but nothing bad happened. Now, other people may be crying. Why did you cry? Well, my dad just died. That's tangible. And so, is there an anti-anxiety medicine that you can give for someone when they're feeling, and it's sustained over several days, and they need to snap out of it, and they're having trouble dealing with a grieving loss of a parent or something like that?
We do. For folks like that, grief counseling, that's going back to, there's times for talking, there's times for medicine. Talking through those times is the most powerful medicine there.
Okay.
But we do have some medicines, might have heard of like Xanax.
Yeah.
So doctors have mixed feelings about those. They work really quick. And so for folks who are really in a tough spot, really grieving, sometimes we'll do a limited course. We'll get you through this week. And it's in 7 doses, 7 pills. The downside, though, is that for some folks, those medicines like Xanax can be addictive.
Yep.
And so that for us is a reason that we're sometimes slow to start it for folks for a long-time treatment, and is why medicines like Prozac, Zoloft, those are our first-line treatment for anxiety disorders. They do have that little delay, but the safety profile is a lot better for them.
Okay, all right. So, as you've said, though, the medicines usually aren't just alone. If they're coming to you and you decide there needs to be something prescribed, do you still stick with the talk therapy and things like that usually, or? Yeah,
so it can depend on the situation. I, as a psychiatrist, tend to be somebody who thinks about the big picture and kind of everything you're doing in life. And so we'll talk about medicines, and medicines can be helpful, but I know that that's not the answer for everybody and the answer for everything. So going back to that couple I was talking about, a big part is that they continued their therapy. Like, we want them to do that, but we might ask about things like your sleep habits, your physical activities, what's your diet. I ask everybody about that all the time.
Yeah.
And so those are things that are going to be impactful and can be part of the treatment too.
We'll talk about that. Diet, exercise, exposure to light, things like that. We touched on exposure to light, but all of those factors as well that can play a role. When we come back right after this, stay with us. We are back with Dr. James McKenzie from Meharry Medical Group. He is a psychiatrist talking about seasonal affective disorder. Some other interesting questions about psychiatry and the like, and how it can really do help people. So, all right, we've talked about meds, and we've talked about access to light, but like with so many things in life, if you're feeling a little lousy, sometimes you got to push through it. But you talked about diet, exercise. You know, there's some days where you just say, I don't want to go. I feel lousy, and you force yourself to do it, and maybe you don't even like it while you're on the treadmill, and then you get off and you leave, and all of a sudden, whoa, magically something's happened chemically in my body and I feel better, but I sure didn't want to go when I started. There are days like that, and you push through it. It makes that big a difference. What is it, endorphins or something? What's kicking in?
Yeah, exactly. And there's a therapy term for that. We call that behavioral activation. Behavioral activation. Where even if you don't feel like it, we're going to schedule some things that are good for you or important for you or enjoyable normally for you, and you're going to make yourself go. And maybe it's one thing a week, but we're going to build up on that. And that's what people see is day of, I don't want to do it at all. But then I go and I do it, and I notice I start feeling better. And there's a delay on it, but it starts catching up and your mood starts improving when you're forcing yourself to do the exercise. Go see people you love, go do something fun that you haven't been doing, and you just put it in your schedule, as we call it.
But it's hard. I mean, because even though it's fun, and you know it could be, that moment when you're in it, you don't feel like it. And it's real easy to say, no, I'm just going to stay here. And if you stay, you know, you may not feel like, but you stay, and you're going to be stuck where you're at, is what I think, okay? You have to do something, right?
Yeah.
What about diet? And are there specific foods? Like, I would imagine you're going to tell me when you're feeling this down in the dumps, it's good to eat lots of Oreos and French fries. No?
That's what our brain tells us, right? Why we want the quick fix. And
fire it up, man. No. Okay, well, you know, if an Oreo makes you feel better, I got nothing against that. But what is it? Is it a diet over a period of time that you need to address and eat healthy?
Yeah, you know, I think in general, we want to make small steps in the right direction. That's how we get sustainable change. And so I think for everybody, we can think about what are we snacking on? What are we having for meals? Are those consistent, or do we kind of wait until we're starving and then we grab whatever we got? And so the problem is that's when we tend to pick the thing that might taste really good but might not be great for us. So big strokes, the bad stuff, the stuff that does not help your mental health and can make you feel worse, greasy food, fried food, over-processed food.
Yeah.
Sugar, high sugar stuff feels good while you're taking it, but the problem is crash.
Yeah, you're going to crash after.
Stuff we do like, fruits, veggies, green leafy stuff, obviously, but you don't have to go 100% that all the time. We want to be thinking about maybe having some fruit and honey for dessert instead of I keep eating a whole box of this and I shouldn't do that.
Yeah. I mean, it's real interesting how that works, because we know some people, when they're down, you talked about one of the symptoms, especially in the winter, is overeating or something, but when you're feeling depressed or lousy about something, and I find this with myself, it's like I get pleasure from certain foods that I really like, and I try in general to eat healthy stuff, but sometimes I will, literally, because I grew up eating them, believe it or not, but I mean, I feel better after having a Big Mac. Okay, I'm serious. If I'm feeling lousy for a while, I'm not saying I'm eating a Big Mac every day, but I'm feeling lousy, and I'll actually maybe even be leaving the gym, and I'll go, damn, I'm just gonna go get a Big Mac. And I'll eat it, and I know it's not great for me, and it's just once in a blue moon, but after I'm finished eating it, it almost feels like something in that Big Mac is locked into my body, and I actually feel good on the drive home. I don't know what it is, but my body likes it. And it's not like I'm like, I gotta go have another one tomorrow. But that brought me pleasure and brought me up a bit, because it's something that I just enjoyed eating on a quick stop on the drive home.
Yeah.
If you want chocolate cake, you know, so you put a little poundage on, who cares? If it makes you feel better in a vacuum, why not? Food brings me pleasure.
I think, you know, in moderation, there isn't really harm in that.
Yeah.
What we want to
Moderation,
think
yeah,
about
you're right.
is that this can get into habits.
Yes, right.
And that's the big thing, is when
Yeah,
it
that
starts sneaking
discipline.
into our day-to-day and we start treating ourselves every single day with things like that, and when we're feeling really
It's
low,
real easy to slip into that
can
too.
do that, right.
You're absolutely right, and that's the trick, is you have to have the discipline, which I think I have, and not do it every day. But why? Because hopefully you're feeling better. You're not feeling that lousy. Now, are there any vitamins or things that, you know, over the counter? If you eat a healthy diet, I know you're going to say you should have yourself covered. But when you have these times of year where you don't have much sunlight or things like that, any specific vitamins or specific foods that go toward helping you through that?
Vitamin D is a big
Okay.
one for kind of this topic.
What does it do? What does it do? Why do you need vitamin D?
Vitamin D, it's part of our bone health, something that we're getting from our diet, but it's actually getting activated by sunlight hitting our skin, hitting the vitamin D inside our body, and then helps us primarily with making healthy bones and strong bones.
Okay, and it's good for your eyes. I know that. They were telling me to do that for the eyes. But vitamin D is what you will end up having maybe a shortage of when you're not having much sunlight or whatever. So vitamin D maybe. A lot of milk's fortified with D and stuff like that. What else? Vitamin C, a multivitamin. Again, those are more general things. Is there anything that applies to seasonal affective disorder that, you know, dark green leafy vegetables like, you know, choking down some kale?
Vitamin C is another one with vitamin D that have both been linked to mood.
Okay.
And so those are good things to consider supplementing ourselves with. The issue, I think you've talked about this with some of the other doctors with the multivitamins, is a lot of us don't need a lot of those multivitamins.
Right. So you just urinate it out.
So you're urinating out
And
the
that's
extra
money
stuff.
going into the toilet, because
So
they're
it's-
expensive.
It's
All right.
expensive urine, yeah.
Yeah.
What you can do, though, is for folks, again, if you're wondering if maybe this is applying to you or this is something that you or a loved one is dealing with, your doctor can check some of these things. What are your levels of vitamin D? Is it actually lower than it's supposed to be? And so that's another reason to check in and talk about this, because there's some things we can test for and say that, oh, look, most people are fine, but you do have a deficiency, and so we're going to start supplementing with.
Okay, is that from a blood test or something like
Yep.
that? You know, I go, because I have high cholesterol, to have a blood scan every 4 to 6 months, just to see how I'm doing. I've got to be on a statin and things. Are there other things I should ask them to test for? They test for triglyceride, cholesterol. You said they could test for levels of certain vitamins?
Vitamin D is one. So we usually just test that if folks are having an issue.
Okay.
So if we're thinking maybe some of what you're struggling with is related to vitamin D levels, that might be something we test. But we don't tend to test it on everybody. If you're feeling fine and you're not having this issue, your doctor probably won't suggest it.
Okay.
But it's something you could bring up with them if you've got some idea that maybe it's something you're interested in or you think it might be affecting you.
What about for men checking, say, testosterone? Now, if you listen to sports radio, it's all about ED, and I'm not talking about that, but testosterone levels, as you age, maybe can go down a bit, and that can affect, I guess, energy levels, things like that. I don't know can that have an impact on your state of mind or depression if your testosterone is crashing, or is it just a normal progression your body adapts?
It's a normal progression for most folks.
Yeah, as you get older, that's going to happen, yeah.
But what we see is that, all of us are unique, and for an individual with a real rapid change in their hormones, something crashing like that, they might notice a real significant change in the way they're feeling. And so our hormonal systems, as those change, they all change for all of us as we age. But there is absolutely a connection to how we're feeling emotionally and what's going on with the hormones in our body. And so that can be, if there's a rapid change, somebody's testosterone crashed, they might feel different emotionally. It is a tricky area where, what's the right amount of testosterone, and it's not real standard. But I think something you said earlier is something I talk about with my patients is these treatments should be helping you get back to normal, feeling like yourself again.
Okay, right.
And so that's what I would think for somebody who's maybe feeling different, found out they've got low testosterone, they're wondering if they should supplement, what is the amount? That's a tricky thing, but I think if you're using the yardstick of I'm feeling like myself again, I'm feeling back to normal, I think that's a good sign that this is supplementing what you've lost.
It's interesting because when I was feeling weaker, and I had that tested once when I had my blood test, and it was fine, the testosterone level, but it turned out, I think, why I was feeling run down, and it comes with this time of year kicking in now, which I'm about to dread. Can allergies play any role in this at all? In seasonal defect? I mean, I know it's coming, but allergies bum me out, man. And
I think this can be one more straw on the camel's back, And so for folks, again, if you really struggle with allergies, if that really affects you, absolutely that can affect your sleep, your breathing, going back to the sleep apnea, just your energy levels, the exact same symptoms we're talking about for depression. If you've got really bad allergies, you might say, man, I've got a couple of these things going on. And so if you're somebody who's already at risk and then you get real bad allergies on top, I think it definitely can contribute and make things worse.
We'll take a break. I want to have all my histamines removed. I don't want any histamine, but I'm sure they play an important role.
Right.
It's kind of like I had nerve pain. Can I just have that nerve severed? And they said, well, then you can't walk. Not a good plan. Those radical moves, not smart, but the ones that he's advocating, good. We'll come back, our final segment, talk about the role community can play in all this as well right after this. Here we go. Back on MorningLine, it is our final segment this morning, talking about just depression, seasonal affective disorder. James McKenzie's a doctor, a DO from Meharry Medical Group. It's good to have you on. Thanks for coming on. It's been a good conversation. I thought maybe the last segment we can just talk about what you're doing here today. The key for this, maybe for a lot of folks, is raising awareness. If you've gone through life wondering why you feel lousy certain times of the year, it could be sad. And again, different ages. Real quick, it's not as rare. Parents, do they need to be aware of this and watching this among young children? Like, Billy is 5 and he seems down because it's raining out.
Yeah, that's, I think little kids can get down in that way.
Sure.
But fortunately, we don't see seasonal affective or, these major mood disorders for
Develops
young
later.
kids. Yeah, it tends to be something that's after puberty, and again, going back to when we got the really active hormone systems. But wouldn't be something for your 8-year-old, your 10-year-old, maybe a teenager, maybe young adults.
Okay, so what then, what can the community do more in terms of raising awareness? You do a program like this, I think people maybe hear it and share it with friends, and then, churches, even schools, what do you think?
Well, I think part of this is we can predict that next year it's going to happen again. And so that's something that could be worked into annual programming about just talking about it, bringing up the issue that for some of us in our community, we may start feeling different around this time of year. And that could be something that's really serious and something that we could get help for. And so maybe it's you yourself, you notice, but sometimes it's our loved ones who see it in us and they've seen the change.
Right.
And we have a family member, a friend who says, oh, you've kind of gone back into your cave, your hole, I haven't seen you in a while. It's gone again. And so I think community organizations, churches, schools can be the ones to bring this back up. As we get into the fall, this is the time of year that can be tough for folks. And so just bringing that awareness, number one, can be a way that more folks are catching it and able to get help.
It's really interesting the way you described that, the importance of maybe those close to you, because there are folks that maybe when they're in it, feel lousy, but they weather it. And then the weather changes outside or whatever caused it, and they're feeling back to normal, and you really quickly forget what it was like. It's like my mother, who's manic depressive. When she's down in the dumps, man, she's in it and it's awful, and she wants the help, but when she's out of it, she's like, I feel great. I don't think I need to take my medicine now. Right. And I'm like, Mom, no, you're feeling great because you're taking your meds. But it's like having someone on the outside say, look, Jim, you're down every fall when this weather comes like this. Your winter's coming. It's every year. Don't you realize? It goes, well, I feel good now, but you're going to feel bad in the fall. Take steps ahead of time. But I guess my point is yours is good. You've got to have someone close to you maybe point it out. Because people can just, they feel lousy, but then when they feel good again, they forget about it.
Right. And that's a common thing.
It's just classic, isn't it?
We're not good at diagnosing ourselves. Nobody, even doctors aren't good at that. And so, I think that's where the role for community organizations outside can really play, is helping us help each other.
Yeah. All right. So, just for folks, maybe if someone's watching, where do you start if someone's watching and they think, okay, yeah, that's me, and I've never really thought about it till now. I'd like to maybe seek some help, or at least find out if it is for sure. How do you suggest they go out? What's their first? Do they call you? What do you do at that point? I guess maybe you start with your primary care physician. Say, look, I'm feeling. What do you suggest for me, or what could someone do if they don't have a doctor right now?
Yeah. So I'd say step one would be reaching out to a healthcare provider that you trust, and saying, hey, heard about this thing. I think this might be me. I'd like to talk to somebody about it, and get in. If you've got a doctor, primary care, your family doc. Anybody like that can be a great first step. For folks who maybe they don't have a doctor right now, they're between doctors, insurance changed, for example. One way can be through your insurance company, asking for, hey, I need a primary care doc. They can send that out. Also, we've got the public health department here in Nashville. It can be a resource for helping either folks who are uninsured or can't get care. So thinking about reaching out, public health department, asking questions, if not your local doctor. And then we've got folks at Meharry. We've got a whole team. And so if nothing else and you're not sure, you could always call us at Meharry.
There's the information on the screen where you can call and get the help. I guess the important point here is if you feel this way and you seek out what he just said, there's no question in your mind, folks dealing with this can be helped. There is help out there. And they may think, well, how can you help me with this? I feel lousy when it rains and it's dark. There's no way. And you have obviously success stories for most of the people that go through this. There's ways you can help, and they're going to feel better. That's why I like doing these shows. That's what it's all about. Some people sometimes think, oh, where do I turn? What do I do? I just don't think, I can't see anything helping me on this. And there's no question.
Yeah, and what I tell folks when we're talking about this is sometimes we feel I'm in a low place, and how are you ever going to get me back to 100%?
Yeah.
And that is a big thing.
And it's possible you may not get back to 100%,
right.
but if you could get
15% better, 20% better, that could be a significant thing. And so with each of these steps, we've been talking about the light therapy, the diet, the getting outside, the medicines. Maybe each of those is a 10% help, a 20% help. But if we stack a couple of those, you can feel a huge difference.
Yeah. And sometimes it's state of mind. Sometimes you can do things, like with me when I was growing up in Oregon, I just got tired of the rain, and I had some of these issues as well. And I took it, I was adversarial. I got mad at the weather, and I'd get up and say, damn it, that's not gonna, and I'd hop on my bike and ride. I had a motorcycle, and raining in Oregon is not going to keep me from having. I mean, I'd get adversarial, and I'd yell at it. I'd get, "You're not going to keep me down. To heck with you. Bring it." Now I know that was just my attitude, but sometimes that helped. I mean, things that you ordinarily would not do in the rain, I intentionally did just to stick it to the weather. And in some ways, that mindset, and again, that's just, I don't know if that ultimately helped me down the road, but I took it as an adversarial thing. You're not going to get me down, dang weather. And then I moved away and said, I ain't ever going back. You know, Jesus. And maybe that's part of it also. But you can have a personal state of mind also. Just get more aggressive with it and say, I'm not going to let it beat me down. For some, that's easier said than done. I know that.
Right, it can be, but I think there's truth to that of saying, I'm not going to let the fact that it's cold today, it's snowy recently, it's rainy, it's a mess. I'm not going to let that be the thing that gets in the way of my health. And so maybe I can't go outside today, but you know what I'm going to do? I'm going to get on YouTube and get some exercise classes.
There you go.
I'm going to call some people I haven't talked to because I can't get outside, but I'm going to connect with my loved ones. There are other things we can do, and I think that mindset of I'm not going to let it control me is good.
Yeah, just go that way. And we didn't touch on this, we just have a minute left, but I know sometimes people try to self-medicate, and the idea of, drinking. I've heard that in certain states where it's dark all the time, the alcoholism rate's very high. Is that true to that? I would imagine. And that would be about the worst thing you can do, right?
Yeah, and it's worse than we're talking about for eating a bunch of sugar and you get a crash. Alcohol can be tempting.
It's a depressant.
It's a depressant, and it's just going to directly make it worse. And so that's, among one of the worst ways we can deal with things like seasonal affective disorder or depression is to add alcohol to it.
Have you found any positive uses for cannabis in the treatment of this, to your knowledge, at this point? Is that being done anywhere?
It's not being done a lot here in our state, but
not in our state. It's not. Oh, okay. So you got to be careful here. But
right. But so that just in general, cannabis and other plants and getting into psychedelic medicine, that is an emerging field within psychiatry of being more creative about what are the medicines we can use. Now, some states have medical indications for cannabis, and so that can be around diet, around appetite, around your sleep, and so things that are related to this, yes.
Growing field. Doc, a pleasure having you on.
Thank you.
Learned a lot. Thank you for coming on. Hopefully we helped some folks this morning.
Yeah, my pleasure. I hope so.
Hey, thank you very much. We'll be right back with a programming note right after this.